Hi, this is my video on characteristics of autism spectrum disorder. Individuals with autism spectrum disorders display many different behavior characteristics. These characteristics start to appear as infants and continue into adulthood. Individuals with ASD are unique and have their own strengths and limitations that are seen at different degrees. Behavior characteristics fall within the areas of social interaction, communication, and repetitive behaviors. Individuals with ASD have a social disconnection. The social limitations make it difficult to make friends and show connections to family members. Typical characteristics include failure to respond to their names, low interest in people, difficult starting and maintaining conversations, not understanding verbal and nonverbal social cues. They prefer to play alone, and they don't make eye contact. As far as communication and language, individuals with ASD face challenges when trying to express their thoughts, feelings, and needs. Characteristics include being nonverbal or having difficulties understanding the use of language, social competence skills when interacting with peers. They have repetitive speech. This is when the individual repeats himself or what they have just said. Individuals with ASD also have echolalia. Echolalia is when the individual utters a sentence or phrase someone else has said. The individuals have difficulty with pragmatics. Pragmatics is very challenging for individuals with ASD, and it's actually one of the characteristics that are used to diagnose for ASD. Individuals with ASD might talk loud, repeat phrases, they talk off topic, they have a hard time understanding jokes, sarcasm, and sometimes they use inappropriate language for the situation. For nonverbal individuals, there are AAC systems to aid them in communication. There's unaided ACC systems that involve using body movement, gestures, and sign language. And then there's aided ACC systems that require external equipment such as pointers, pictures, communication boards, paper, pencil, speech-generated devices, and writing programs. Repetitive and stereotype behaviors are common among individuals with ASD. The behaviors are related to abnormal developments of the neurological system, and it interferes with daily interactions and activities. Repetitive behaviors include repetitive language, rocking, tapping, arm flapping, scratching, smelling of objects, and repetitive blinking. These behaviors are associated with adapting and coping to our environment. The behaviors are caused by overstimulation of the senses and are triggered to soothe and calm the individual.